This is a brief tutorial of the EYS Florida Clinical Team site. So you make sure you go to Sharepoint, right? And then you go to Documents. You find the FL Clinical Team. Go to the Clinical Team Docs there, what you will have access to. And then you will see a whole host of good things. So you've got some blank forms like the Suicide Safety Protocol. And then if you navigate through court reports, you'll see there's a court report template and a court report example that you can use language that describes the services that we give. The EYS phase assignments, so please click on that, go through these things that were just recently uploaded. Remember that on each of these are just suggested assignments, not the assignments that you have to use. I want you to focus on the relationship as a clinician. That is the change agent, not these assignments. So if you have assignments that you feel like will match the diagnosis of the child better than this, then use those. Use the assignments that you know. There's also a navigation. If you go back to clinical teams docs, you can go to training resources and find Aliva training. And then this is a tutorial that will walk you through how to add homework and find the homework bank from our electronic medical record, Aliva. They have a Wiley homework bank that you can choose from. So that's your tutorial there that you can move through. So that will be an important navigation for you. Going back to clinical documents, then to these phase assignments, you'll see we've got the overall principle. Base camp is the truth stings but lies destroy. Ascension is not what you can get, but what you can give. So these are all assignments in that vein, and each one should last 1 to 2 weeks, where you process these and make sure that you're taking clinical progress of each client and reviewing those in your weekly clinical meetings, so you can get reports from the clinical supervisor or manager on how they're internalizing these skills in their behavior. So do we see in their behavior what they're learning in therapy, or are they just taking their therapy hat off and putting it back on? So we're going after internalizing skills. Free solo is all about turning pain into wisdom. So this is where we take the deep dive into complex trauma, understanding trauma, simple versus complex, and those assignments are there. Summit is all about safeguarding success. So you've got a relapse prevention outline, which is a basic and more generic outline. And then you've got your safeguarding success plan down here. All of these assignments are geared towards culminating what they have learned in a residential level of care and getting ready to move to a lower level of care. You'll see outpatient expectations, their sense of identity. What are they going to do when the training wheels come off and the structure of the program and supervision, line of sight and sound is no longer there? So a good assignment for that is internal versus external control. So I hope that helps you with a broad overview of the EYS phase system. Please go to the website and read over the clinical climb for more information and play around with these resources that we have here. Okay.